Providers should be preparing for the upcoming compliance deadlines for the 21st Century Cures Act, which focuses on interoperability for better sharing of patient health information. In the age of COVID-19, there's certainly a growing consumer demand for these capabilities, but also multiplied pressures on health systems' time and resources. Those who have been monitoring the Cures Act rules know the compliance dates have been delayed, but the delays were announced at separate times, often with little fanfare. So there's a good bit of confusion around what is due when and around what providers should be doing now. You might be surprised to realize that, despite being moved back, the first deadlines for providers are still just around the corner. In fact, the first two requirements, updating digital contact and attestation, are due March 31st. Less than 1 week later, the information blocking requirement takes effect April 5th. Less than a month after that, the ADT notification requirement takes effect May 1st. Let's review the individual requirements and deadlines. By March 31st, health systems must ensure their provider's digital contact information is up to date in the National Plan and Provider Enumeration System, NPPES, database. They also need to have ongoing maintenance programs to ensure they stay up to date. The effort can be considerable. Having individual providers delegate access can facilitate greater compliance, but there are complicating factors. For instance, providers often don't know their direct trust address. And while health systems can conduct bulk uploads on behalf of providers, doing so requires accurate contact information and an established process to do so. Health systems already should be submitting periodic attestations for the CMS quality program, indicating they are not information blocking. The difference is that with the March 31st compliance deadline, CMS will now hold providers accountable. Those who block information will incur penalties, most likely in the form of disincentives. They will also be publicly reported on the CMS Care Compare website. The information blocking requirement is the most time and resource intensive one. The new deadline is April 5th. To comply, providers must securely share electronic health information with patients, community providers, HIEs, and other requesters that have patient authorization. This is such a dramatic shift in data management that health systems need to make not only technical changes, but also significant operational changes. They will need to make sure their technology, processes, and employees are equipped to respond to data requests. This includes updating business agreements and policies, including those related to HIPAA. They will need new processes and clinical workflows to ensure the necessary data is available, accessible, and provided in a timely manner and in the method requested. Since EHR developers are not required to implement functionality for USCDI now, providers need to develop their own request response workflows to include all USCDI items. One of the most critical actions health systems should take now is use case analysis that outlines the impacted workflows where changes need to be made for compliance. For those who are able, a comprehensive change management and operational readiness program will facilitate a smoother transition with more beneficial results. By May 1st, with every patient admission, discharge, and transfer, health systems must notify the patient's primary practitioners. The patient's care team will need to be correctly updated in the electronic health records, potentially from multiple provider databases. Health systems need to know which data is going to whom now. They also need to identify providers who are not already receiving the notification via HIE push, interface, direct trust, fax server, or other routes. Additionally, health systems should map out new workflows to build in solutions to common problems up front. For instance, automating notifications could create alarming new levels of alert fatigue. Enterprise notification services with customer relationship management tools embedded can prevent this and improve satisfaction. The final compliance deadline that affects providers is further off, December 31st of next year. For health systems, this deadline requires making sure that all applications that are sources of patient data will meet the certified electronic health record technology compliance. Health systems must ensure their vendors have made the appropriate technical updates so that their electronic health records and other systems are not exposed to information blocking. Steps include inventorying applications, identifying contracts, and securing the appropriate legal steps to hold vendors accountable to the certified electronic health record technology compliance. There's a lot to do and not much time left to do it. particularly with so many competing priorities today. If you're not sure where your organization stands, take our 8-question assessment to determine your readiness score and plan out next steps.